In this short video, I'll share the critical 4 powerful keys to stopping the damage and back pain and beginning the healing the right way immediately if you have recent or chronic back problems. Hi, this is Dr. Hobbs, restoring hope and health for lifetime family wellness. Now, there are lots of books on this, some too confusing to make sense of, and many too simple or vague to be useful. So today, I'm going to boil it down to 4 action steps. Some you can do for yourself, and some you'll need help with. Step number 1, stop causing harm and brace as needed. If it sounds simple, but it's often overlooked. Of course, you're not going to do something that causes lots of pain, at least if you can avoid it, but those smaller repeated traumas can also slow or stop your healing. For example, lift correctly, carry correctly, avoid the 4 harmful exercises, which include the traditional full sit-up, the straight leg raise, the back extension machine, or the Superman hold, and the offset push-up. And even vacuuming or sweeping can set you back if not done correctly. In the description, I've linked to a short video for more details on each issue I listed. Step number 2, restore nerve communication. Often the reason the injury happened in the first place wasn't that you did something crazy harmful that you hadn't done before. It was something else. It was the nerves not communicating well between your brain and that part of your body that you injured. So you went to do a common activity, but you didn't have common nerve control. So you injured yourself, and now you can't manage to recover. The fastest way to restore nerve communication is the chiropractic adjustment. That is what it's designed to do. Most people think of it as putting a bone back in place. That's the old bone cracker way of thinking. Times have changed, my friends. Now it's about how we influence the brain with the adjustment. Now the body is working well. A body that is working well is continuously restoring nerve communication and healing itself. But once the problem sets in, the brain can't fix itself or the body part it controls without some help. That's why many people go to a chiropractor regularly, even in the absence of pain, to prevent the nerve disruption from setting in and creating other body dysfunction in muscles, blood flow, or organ dysfunction. All right, step number 3, remap nerve coordination. This means keep doing what is getting you better, as in step number 1 and number 2, stop causing harm and restore nerve communication. Then add good exercises that challenge the brain and body with specific and appropriate exercises of the core. Specific means there is a right way to do them. In fact, we usually begin with core muscle contraction biofeedback so that you know that you're doing it right. Remember, you're restoring nerve communication and coordination that has been lost. Appropriate means that you start at the difficulty level that is right for you. Challenging, but not hard enough to set you back. Finally, number 4, build endurance and tissue stability. We do this by continuing steps number 1 and 2, but with less frequency, and adding to step number 3 with more reps, more technical difficulty, and just more regular daily activities. That's it, your 4 keys to successful back rehab. It's really quite simple when you know what you're doing. So why don't all doctors do this? Well, I can't speak for them, but I know it works really well, and I'm sure more and more will adopt this approach as they learn about it. Now that you've learned about it, are you thinking of someone who could use this information? Share it with them. If it's you, give us a call. We'd love to help you out. If you're already a patient, hopefully this reminds you of the importance of doing rehab the right way. Ask us for specific help if you got stuck on one of the steps or skipped one. Have a great day, and remember, the longer you're healthy, the healthier you can become.